Memorial Hospital Pembroke has been in the community for over 20 years. We're in the heart of South Broward, so we're available anytime for anybody to walk in. We have a variety of services, and one of those is the emergency department. We provide care 365 days a year, 24 hours a day. We have a great staff of emergency physicians, nurses, paramedics that are here to take care of you.
The emergency department here at Memorial Hospital Pembroke serves a pivotal role in our community. We provide access to world-class healthcare kind of right in their backyard. Here at Memorial Pembroke, we have access to some of the best stroke care, congestive heart failure care, and respiratory care.
When a patient arrives, I think one of the important things is when they first see that nurse is that bond between the nurse and the patient that they form immediately. The nurse is able to put the patient at ease a lot of times just by making that eye contact and saying, you're in the right place and we're going to take care of you. I want to make sure my patients get excellent care. I don't want to hear that their care was good. That's not good enough for me.
One of the most important things for people to realize is how long we've been part of the meshwork in the community. Whether it's people who've been able to come to say, hey, Memorial is my hospital. That doesn't just develop instantaneously. What we do takes a lot of experience, years to develop systems that have been in place.
What's going on today?
We handle from the most minor emergencies to the most severe cases. So I might see a sore throat, an earache, a scrape on the knee, or we can see a car accident victim, a heart attack, a stroke victim. They all come into our emergency department, whether they're 1 month old to 99 years old. We see everybody, and we're all trained in the entire spectrum of this.
When you arrive at the emergency department, if you need immediate care, there's no delay. We're taking you right into an exam room for a physician, nursing, and team to take care of you immediately.
We want to connect the patients with our physicians so that they get some face-to-face time, and we've developed some processes. We have what we call a super fast track. So if you come into our ER and you have something, a minor cut, a sprain, maybe all you need is a simple x-ray, we can bring you to that specialty care area where we have board-trained and certified physicians, expert emergency nurses who can make a decision in care. And our goal is to get you out of the emergency room in 60 minutes.
Our emphasis is on efficiency. We want to make sure from the time you come in that someone's addressing your pain, someone's addressing your concerns, that we've started our evaluation.
A few months back, I came to see my pulmonologist, which is in the building across the street. And when I came downstairs, I literally had a moment where I couldn't breathe. And I managed to get to my car. I crawled to my car and I honked my horn. And that's when one of the EMTs was leaving his shift from the emergency room and saw me. If he wasn't as alert as he was, and if he wasn't as quick as he was, I can say that I probably wouldn't be here speaking to you. Moments later, not even a second later, I feel a stampede or hear a stampede coming from behind me, and it felt like the entire emergency room department was outside. I've never had anybody in any emergency room department react in the quickness that Memorial Pembroke did, and they saved my life, I'm convinced.
When you're ready to be discharged, we don't just hand you your packet of discharge instructions and say, see you later. We make sure you understand that through your comprehensive care and going home that you're going to be following up with certain services. So for example, wound care, for example, a cardiologist, or the cardiac services at one of our other sister facilities. The whole network of Memorial is at your fingertips, and we're going to make sure that you understand which piece of that you're going to follow up with.
Our commitment to the community is to make sure that everyone's taken care of. So whether it's referring them to the primary care clinic, getting them an appointment the same day or the next day, making sure our social workers come by and say, hey, this is an important prescription. I'd like you to get this filled here in the ER for us to make sure that this patient goes home. We may have a nurse come to their house to check on their blood pressure the next day, making sure their weights are being checked. A doctor or a nurse coming to check up on them at home or by phone to make sure they don't come back in with the same problems. Our job is to keep you healthy and out of the ER. We're there for your emergencies, but we want you to be well maintained, healthy, and be able to continue what you enjoy doing.
At the end of the day, I go home with a smile on my face because I know I've done something in my professional life that has changed somebody's life.
The people who come to work here enjoy what they're doing, they're proud of what they do, and our patients can sense that. All our docs and all our nurses and all our clinical workers and non-clinical workers have that sense of pride and enjoyment that spills over into the care they deliver. The one thing that I would say unifies our community is they have high expectations of their healthcare They're educated for the most part about their conditions. They're demanding consumers. They have expectations of what an emergency department should be. And it is our goal to exceed those expectations and say, you're absolutely right about your concerns, and we're here to help you address them. And the patient is always the center of the focus, whether it comes to their education, their outpatient management, their discharge, or their emergency care. We are here to serve the community. That's the pillar of this hospital.